So I'm here with our brand new patient, Joseph, amazingly nice person. And Joseph, you shared with me you hadn't come to the dentist in 20 years.
That's
I
correct.
jokingly said you were 65, I was 25 back then.
Yeah, right.
Now we're 85 and 45. What inspired you to come back to the dentist?
Primarily when the caps fell off the front of my teeth. As you can
Gotcha.
see right there, I felt enough is enough. I've got to get my teeth if I'm going to communicate with people.
Yeah.
If I'm going to have any relationship with somebody, it's going to look terrible. I can't smile without covering up my mouth.
So I think that was a great idea. Come back to the dentist and
That's right.
see what's happening. Now, how did you choose this office? You're a new patient here. How did you find out about us?
Well, it had to do with the advertisement that I received in the mail, and it's this brochure, and it showed all the doctors there.
Cool.
And it had good explanation of everything, your expertise, your approaches, your different treatments and so on. And I felt this is great. I've never seen anything like this. It's a nice, colorful brochure.
Thanks.
It attracted me, and it gave all the information, page after page, and I liked it.
So it was enough for you to learn more, enough to
Right.
get a good sense of numbers. So then you
Right.
came in today for this complimentary consultation.
Right.
You took a panoramic x-ray.
Right.
Tell me a little bit about, authentically, your experience with me in kind of explaining what was going on, the approach. Tell me about that.
Well, your approach was good.
Thanks.
It was very thorough and very hospitable too. I mean, I really felt comfortable. So, and I enjoyed it.
I appreciate
And
it.
you went over all the details. You were quite honest about everything,
Thanks.
and that impressed me a lot.
Thanks.
And also seeing the X-ray after a while, explaining everything to me,
Yeah.
the technical points of it, and the good points and bad points, and that sort of sunk in. I really like that, and
really
I
appreciate
know
that.
now which way to go.
And that's my goal, is to make people less confused. And that's what I really love to teach through stories and tell through stories. If any of the examples I give resonate, whether it's like, hey, you have a bone infection, it's like a little fire in a house, you don't want it to get, you
Right,
don't want it
yeah,
to
you
spread.
brought that up, right.
Does that motivate you to be like, oh, I should probably do something?
Of course. Plus, it alleviated the anxiety.
Awesome.
I never felt more comfortable than I am right now.
Thanks, I appreciate that.
Give me a blanket and I'll go to sleep.
Yeah, I'm glad you. And then one of the things I share with dentists is when people come to the dentist after 10 or 20 years, they're going to have a lot of work to do. So you want them to feel too overwhelmed, but you want them to feel motivated to move forward. So do you feel motivated to move forward and what's the next thing you're going to do?
Well, the next thing, as per your advice, was getting the cleaning and getting onto the extractions and so on. And I figured now I've got something to look forward to.
Yeah.
And I know I don't have to extract everything, which really helps me a lot because I don't feel I want to have everything done. You had pointed out that a lot of the teeth are very healthy yet. So let's get rid of the bad ones.
For sure.
Put in the good ones.
And figure out how to replace them. We have a team here. And then before we wrap up, and I so appreciate this is going to help so many dentists. Very, very few dentists and teams get to see this, Joseph, so I'm so appreciative and grateful you're letting us do this. Then I brought in Kate, right? So we had a great team member take your x-ray, doing everything, but then I brought in Kate to share what would be the next step financially and the treatment plan, the starter treatment plan. How was your experience with Kate?
Wonderful. It just absolutely fantastic. I've got my treatment case, and I could see right away what expenses are going to be, and I feel comfortable with it.
Awesome. Yeah, and that's why I teach people is that to make things digestible to patients to move forward. I said, this is our starter treatment plan. Let's do one or two good things to get you healthier. And then we did talk about the future. You asked me about implants. You were curious. You're kind of relieved to know that you're not really a candidate to have all of your teeth removed.
That's
and
correct.
replaced.
Yeah, that was good.
But when I explained the difference between the snap-in, implants and the stand, it was just personally interesting to you, right?
That's all it was.
Yeah. And maybe you have a friend who needs it one day.
Perhaps.
Yeah.
But, I've seen a lot of television commercials, with these people with implants. And I started to figure out, do they go over or, are they into the gums and so on? You explained it quite thoroughly.
Thanks, I appreciate it. And I teach dentists this one thing about system for talking, and I don't know if you remember from 25 minutes ago, but I said, hi, my name is Dr. Paul. I'm so glad that you're here. the dentist is not everyone's favorite place to be, so you should be proud that you're here. But I have one question for you, and that's what can I do to make you happier by the end of this appointment? So are you leaving a little happier than when you started?
Yeah. Yes, I am.
Awesome.
I'm leaving happy. Yes, and I don't know what else to say.
Yeah, well, you're on the path to better chewing and smiling with confidence. We're going to make sure that, but I just want to share again, thanks so much for allowing me to do this. I really appreciate it.
Quite welcome. I'm glad.
Have an awesome day.